on the questions that you're about to ask. So what questions should we ask? Who else is telefloor? No one? Who's ICU? All right. So who wants to ask questions?
I would ask if
So-
they're asymptomatic.
Yeah,
As
they're
far as
bringing
blood
a,
pressures.
yeah, they're
is the
bringing a
actual-
patient to the ICU for
5 seconds.
for 6-second pause in AFib to the ICU because the ER physician was worried. What would make you agree with the ER physician, and what would make you say this patient doesn't need to be here?
Excellent question.
What's your name?
Desiree.
Desiree.
I guess at that point I would be looking also at electrolytes.
Good. So we'll think about the electrolytes.
Also, past medical, like if they're on a beta blocker and maybe took too much or they're confused and they overdosed on a
Yeah.
beta blocker, they're causing some of these pauses.
Yeah, so meds, right? Because some meds can cause block, like beta blockers, calcium channel blockers, etc. And other things. There's other past medical history. Great. So we want to know these kind of things because if a matter of potassium, for example, you could get bradycardic. Is if a matter of beta blocker, calcium channel blocker, you can get bradycardic. So what would you do with a patient that has no reversible cause to have AFib with pauses lasting more than 5 seconds? So all your questions are
Those good
negative.
hormones.
We're going to put pads on them.
So there's a possibility about putting pads. Why?
Because if it gets worse and becomes symptomatic, we're going to have to intervene.
Yeah. So pads. Who else would put? I'm not saying it's wrong. I just want to know who else agrees or disagrees with putting pacemaker patches on someone that has a 5-6 second pause asymptomatic. So basically, you're worried that he might. What are you worrying about? Before I say what you're worried about.
Well,
Before you tell us.
I mean, if it's greater than 5 seconds and we're asymptomatic now, it doesn't mean that he's going to continue to be asymptomatic later. If the frequency keeps happening, and it's more of a precaution or warding away bad juju theory than a medical intervention right then and there.
Because you want to treat the symptoms.
Yeah.
What kind of symptoms do you think you can treat, or what kind of symptoms do we know we can treat from this pause with pads?
None.
But you want to.
Yeah, no, I mean, nothing.
Yeah.
But if we go asystole or if we go into a ventricular rhythm that we can shock.
I like the second option. Yes. So let's talk about two things that can happen. One is a long period of asystole, and a long period of asystole will cause loss of consciousness. What else could a long period of asystole cause? Ventricular arrhythmias. Why?
Because your body's trying to compensate, and it's your AV node is saying we gotta start making up that our atrial rhythm's not doing it.
So not so much, because so you were correct in what you said first about the ventricular arrhythmias, but then you said because the AV node will start firing, but if the AV node is supraventricular. We consider AV node rhythm,
So that
not ventricular rhythm. Ventricular rhythm will be
More
idioventricular rhythm, will be ventricular tachycardia, ventricular fibrillation, PVCs, non-sustained VT. Those are ventricular.
like the bundle, would there be any like the slow ventricular, like the 20 to 40?
Yeah, so
That would be your.
that would be idioventricular rhythm. Yeah. So if the ventricle, we'll get back to that in a second. So when you have asystole, and you have a long pause, and then you have the rhythm, some rhythm that start, your QTC is long. The QT prolongs to the degree that there is a pause. The slower the heart rate, the longer the QT. So if your heart rate is slow and your QT is longer, you are at risk for not re-entry. I mean, yeah, it could be re-entry, but there's a particular ventricular arrhythmia that is caused with long QT. Torsade, yeah. So you worry about torsade de pointe. So that is something that the pads will help you. For loss of consciousness, would the pads help you? Would you have enough time to run into the room and pace the patient before he loses consciousness? No.
No.
And if the patient is already in bed, he's not going to get hurt unless you pace him because it hurts. So I'm not saying that I totally disagree with the pads. I just don't think they would be of any use unless you suspect torsades. So,
well, there's nothing. We would never be able to pace unless there's a rhythm to synchronize to.
no, you could pace asynchronous because if there's asystole.
Right. Okay.
Right. I mean, you pace, but you're synchronizing to QRS if there would happen to be one.
Mm-hmm.
So basically, if you have a QRS, the defibrillator will sense it and will not pace. So it's synchronized, yeah. All right, so